One huge reason I've come to visit Thailand is for this better medical health treatment. A few years back, I developed a pretty bothersome autoimmune disorder, and it's taken me years to somehow feel somewhat normal. And I'm still like, it's a journey, right? This thing isn't curable, and it's constantly messing with my digestion and my moods and hormones and inflammation in my joints. And I have other issues beyond this as well, spine issues and nerve issues. And I'll get into some of that because this is the health channel. I made a vertical video kind of highlighting the cost of medical tourism. So if you want to check out some of those, like cost of living in another country type stuff, go check out my other channel, Chase the Escape. But this one, I promised them over there that I'm going to talk about this health stuff that I recently received at a local clinic. And I'm living in a very affordable place. It's way cheaper than Bangkok. And so you'll see some videos out there saying like, oh, Thailand's changed, it's not cheap anymore. It's still cheap in certain places, but yeah, if you want the luxuries of Bangkok, you're going to pay a more premium price, and I won't fault you for it. It's still more affordable than America, so it's worth visiting. It's worth staying at for a week or two or a month or 6 months if you love it, if you love cities. But there's lots of variety. But go check out my Chase the Escape for the living stuff. This clinic I went to, I just wanted to see if they could perform basic blood work if I'm going to be living in this area for a little longer. I wanted to see how convenient my health visits can be. And they do have bigger hospitals that are within like 20 minutes. And I might go check out one of those before I leave. I'll get into why in a second. But I wanted to first say, like, there's lots of these little pharmacies that do offer a lot of variety of things that do actually work, but they also have these little doctor clinics, medical clinics. So I go in there with my girlfriend, and because I wanted her to come along because I knew there'd probably not be anyone that spoke English there, and my Thai is not good yet. I'm still very new. And I could use Google Translate, and I think that's what most people would do to just get across basic stuff. But if you can have a translator there with you, that's just quicker, more convenient. So she was explaining what blood tests I was requesting and back and forth. And this is maybe somewhat different than America because I figured we could just go in and say, yeah, I just want a basic health checkup and speak to my doctor about running some blood work. But the nurse at the front and kind of in the main lobby, so there's not too much privacy, just to forewarn you. Maybe it's not like that at every clinic, but you're just kind of speaking out loud in front of everybody, if you have more serious health issues. So I don't know, some people like to be private about that. Some people probably don't care. I probably ultimately shouldn't even care because I'm there for thyroid stuff. So just to warn you, like, they might want to know why you're there even before you speak to the doctor, basically. And so we go into the doctor, and he spoke like very, I don't know, like maybe 10%, 20% English, 30, maybe I'll be generous. But Pui obviously spoke more English than he, so she was mostly doing the translating again. And we were going over specific stuff I wanted. TSH, T4, T3. A lot of people even find with my health conditions beneficial to know reverse T3 because that's going to tell you how your liver is kind of functioning and returning some of that hormone. And I've had fatty liver issues, non-alcoholic fatty liver issues in the past. So there's certain specific things I wanted tested, but I kind of knew to start I should just keep it simple for the most part. So overall, I mean, he, and I even like used Google Translate and showed him a couple times like exactly the test I was interested in having, and I wanted to know like what cost that would be, or if there's a package deal. Some of these places do offer packages at discounts or whatever. to test multiple things. So I went away thinking I was going to get all those things specifically requested after showing him translated on Google Translate each individual item. I got like 90% of it right. And the other 10%, I don't know exactly what the reason was. And that's the problem with like, even we probably didn't ask deep enough questions, or she ultimately doesn't know why they chose not to test these specific ones or whatever that is, right? And it's not a big deal, but sometimes if you're a health nut like me, and for this health channel, it's like I'm trying to get to the root cause and figure out in detail as much as possible, because no one else seems to be doing much research in Hashimoto's, and the doctors back home don't really give a shit. They think a levothyroxine pill is going to solve all your symptoms, and the truth is it doesn't. For many of us, we still endure joint pain and inflammation and gut motility issues, and that just, there's so much interlinked, especially with the gut stuff. Like, you have no idea how much that controls of your body once your gut starts not working properly. But anywho, all of that done was about 2,000 baht, which, as I mentioned on the other video, which like $60 or 70 maybe, somewhere in there. And to go see a doctor in America, even if you have, I mean, unless you're on Medicaid, which most of us, it's hard to qualify for that, because you have to be like almost homeless pretty much without anything saved. If you start to become responsible and try to have a savings, like an emergency fund and stuff, that's just not allowed, because you can't even save more than $2,000. Once you're above that, they kick you off Medicaid, and then you have no health insurance. So you can't even try to save for an emergency fund or any of that business. And just to get into the doctor's office, you're going to pay the medical clinic at least like $100 or more in some places. And that's before they even talk to you. And a lot of the, especially endocrinologists for this shit that I have, they're supposed to be our specialists, which no, they're not. They don't know shit about it. And a lot of times they're trying to do it through telehealth, and then they just shut off the screen when they feel like they don't want to test for any shit, and you're tired of ranting at them. But it's just such a huge disappointment when you have to spend all that money to get very disappointing feedback, or like healthcare just in general. There's no healthcare, hardly. So then you're just even more depressed when you leave, because nothing got fixed. You're even deeper in debt that you can't afford, and you're struggling keeping insurance or finding out, how do I pay it without insurance? And it's no wonder the suicide rate's gotten so high in the last few years with certain people. And I not sorry to bring that even up, but like, yeah, this hormones shit and the digestive shit, and I'm shitting blood nearly every week back home. Yeah, I was fighting thoughts, because what type of life is that? And I spent years suffering silently and with minimal help. At least I got the help I needed at the time to get through, because I've made some strides. That's what this whole channel is about, is like, even with lifelong health issues, like, what can you do to minimize that suffering? You gotta make peace with your limitations. And yeah, I've done a lot of grieving, changed a lot about my life, and still a work in progress, you know? It's a journey, not a race. So if you're gonna live in rural Thailand, it's kind of what this is gonna be about now. Yeah, there's health clinics nearby. They could probably treat you for basic things. You could get by with Google Translate to a degree. But if you have more specific issues, obviously I know it's probably a rare thing to treat around here and at such a small clinic. So it is probably still worth visiting the most reputable hospitals, probably located in Bangkok, and maybe Pattaya has a branch now. I don't know how good reviews or anything. So just look into it yourself, do a little research. So if you have specific health issues you're trying to do medical tourism for, look at the main hospitals is my suggestion, because they're also going to have translators there, which will just make communication a little bit easier. But yeah, still recommend it based off price alone. Before even this year back in America, I already spent probably over 1,000 on getting mostly nothing done or accomplished. And at least I could spend that for the plane ticket, and most of the accommodation here is cheap enough anyway, so it's like I'm saving money by doing it all over here. It's crazy, isn't it? All right, I'm not going to ramble too long. If you got anything beneficial out of this video, feel free to share it with friends or family or anyone else struggling that you know of. Leave comments below if you have questions or recommendations for medical tourism. Until next time, stay healthy.